Working together, communicating together, we can learn from each other, combine our knowledge bases, correct misconceptions, and force ourselves to be more creative, to make new solutions that solve problems in a better way. I have personally seen how impactful it can be to have impairment in your communication. The consequences of having a hearing impairment can be very specific, as in losing communication with all of your significant others in your daily life. There's some evidence out there showing that hearing impairment can lead to isolation or reduction in social participation, which can ultimately have an impact or is a risk factor for developing cognitive decline and dementia. We don't fully understand how normal hearing listeners are able to communicate in really complicated, realistic listening scenarios, like in a cocktail party, in a restaurant, or even a meeting room. In my group, we're interested in looking at how to improve the quality of life for hearing impaired individuals. And to do this, we are interested in engaging in both basic and applied research, where we look at better understanding hearing impairment and how we can use technology to treat that impairment. We are physically located within the center on a daily basis, giving us the chance to fully integrate into the clinic with the clinicians and the patients. So we've put in a big effort on developing research labs that first and foremost provide synergies with the clinical facilities and what we like to say is more research-focused facilities that we have at DTU. We have a huge anechoic chamber where we have 64 loudspeakers sitting in a sphere. An individual can go into this lab space, hear sound coming from all of these loudspeakers such that they get to percept that they're in a listening situation somewhere out in the real world.
Now, we use all 64 loudspeakers to simulate standing in the middle of the orchestra, playing in the Agia Irini Church in Istanbul.
My vision for this spatial hearing lab at the Copenhagen Hearing and Balance Center was to embed a loudspeaker array into a clinical room such that the loudspeaker array is in the walls and ceiling, tucked away, cleanly organized, such that a patient can come into the room and feel like they're in a normal clinical room. The clinicians I work with on a daily basis are excited about the lab space and excited about using the technology to provide better care for their patients.